Hi, my name is Hanna and I'm 23 years old and I'm from Sweden. I was first diagnosed with asthma when I was 5 years old, and during my childhood I had the normal, what you would call infectious asthma, so I only had to take medication when I was sick. So besides that, I was like any other child, could play around, hang out with friends. I played soccer and I did horseback riding and whatever else children did. Then I started to develop allergies when I was around 10, 11 years old, mostly to pollen, dust mites, and animals. But then when I turned 15-ish, when I entered puberty, my asthma got a lot worse. And at first they thought it was mostly anxiety. But then after a severe asthma attack during a PE lesson, I got sent to the hospital to see an allergist and pulmonologist. And then they realized that it wasn't in fact anxiety, it was that my asthma had become a lot worse. After starting omalizumab, the amount of severe asthma attacks I had decreased, so now I only have them a couple of times a year, which is a huge difference, even though my lungs aren't really working as they should, and I am still on a lot of medications, and my asthma is still getting worse and worse. We still think that omalizumab has helped me a lot, and especially during the pollen season and with my animal allergies. So before I still am really allergic to cats, and I couldn't even be in the same room as someone who had a cat at home. But now I can't be at someone's house if they have a cat, but I can still meet them and I can hug them, and that is something that is very good because a lot of my friends have animals. Apart from omalizumab, I'm still on a lot of other medications. I still have to take steroid tablets, and we are trying to get me off of them, but it is a struggle. And I take several different inhalers every day, as well as montelukast and theophylline tablets. And in addition to that, I also am on antihistamines and other things for my allergies. But in the bigger picture, my medications do work, even though I still get severe exacerbations when I, for example, have an infection. So I used to be on antibiotics. I was on antibiotics for like 6 months because of an infection, but now finally I'm off those, and that's great. Luckily, I don't have a lot of side effects except for the usual side effects that most people get from steroids, weight gain, and sometimes I have trouble sleeping. But I'm considering myself lucky that I don't have a lot of side effects, since I do have to take so many medications. So that's a really good thing, because then it motivates me to, continue to stay on these medications. Because of my asthma, my life does look a bit different than most other 20-year-olds. I have to remember to take my medicine every single day, because if I don't, I know that I will end up in the hospital. I am a lot more tired than most people my age. I sleep a lot. I don't really have the energy to go out, and I prefer to stay at home and have my friends come home to me. I don't, for example, like to go to the cinema, because I know that there probably will be something there that will trigger my allergies. But with some accommodations, I still can do whatever I want. I just have to think a little bit more and plan a little bit more ahead. And with the help of others, most things do work out. In the future, beside from finishing my medical degree, I have high hopes for new biological treatments that I know are under development, because I don't have eosinophilic asthma, so I haven't been able to try other biological treatments except for omalizumab that I am on now. So both me and my doctor have high hopes that there will be a biological treatment that will work better for me. So that's something that I'm really looking forward to, and I hope will come pretty soon. Since severe asthma is an invisible chronic illness, I think that it's really important that you as healthcare professionals remember and acknowledge that, because most of us are in the community are not seen as sick, but we are, and it can be a struggle sometimes to get people to understand that. So encouraging the patients in that and helping them to be as healthy as possible is very important. And I also think that it is really important to see the whole patient and not just the asthma, because we are much more. And with healthy lungs, we can do everything else that everyone else can do. And I think it is really important to listen to the patient and to hear what they think is important, because that is what the treatment should focus on. And that will also increase the cooperation with the patient. Thank you so much for listening, and I hope that I gave you some insight in how it is to live with severe asthma.